transvaginal ultrasound. And of course there is a gestational sac here. This ring is the yolk sac. This is the yolk sac, and this is the embryo, as you can see here. And this is the membrane around the embryo. And when you're reaching about 11 to 14 weeks, sometimes you mistaken this membrane with the increased transnuchal translucency. And this is a left corpus luteum cyst, as you can see. And when you find this cyst, just for follow-up, up to 12 weeks, to be sure that it disappeared. And if you find the cyst and did not disappear, so you should tell the patient or the lady, the pregnant lady, that this cyst should be followed up and that she's at risk of torsion. Because of course, when the pregnancy is developing, especially reaching the second and third trimester, of course, this cyst, when it's increasing, if this is not a corpus luteum cyst, another cyst or pathological cyst, it would increase in size, and so it would not be apparent by ultrasound, because the gravity uterus, when it's increasing in size, that cyst will be posterior to the uterus, and so it would not be very easy for you to see or to detect this cyst. That's why it's very important, please, to tell your lady or your pregnant lady that there is a cyst, and this cyst is present, and that's if it's a continuous cyst. It's increasing in size, and we ended the 12 weeks and still the cyst is present and it's increasing in size. So we should tell her that you have an ovarian cyst, and this cyst is increasing in size, and it may end in a complication, which is the torsion. And so if you develop any acute abdomen when you're still pregnant and you are advancing in your pregnancy, so you should tell your doctor or your obstetrician that you had that cyst, and that cyst was present in the first trimester. So by this scan, you have some points here we should assess, or we should comment on, or we should see. It's a transvaginal ultrasound. This is a very early pregnancy. We can see the embryo inside, and we have seen the fetal life positive. There is a yolk sac, as you can see. There is amniotic fluid around the embryo. Fine. This is a fine amount of amniotic fluid. And also we had seen left corpus luteum cyst. This is again the yolk sac. There is a tiny separation here of the chorionic tissue. If you can see this is a very tiny separation here, but that's just for follow-up.